So we have this 51-year-old male with a history of hypertension, low testosterone, and prediabetes, presenting to the clinic with right shin wound and left knee swelling 3 weeks after he sustained a forward fall while doing some maintenance work around the house. Current complaints are right shin wound is open and it is draining serous fluid. Surrounding is warm and there is some redness noted. No temperature difference between the two extremities. Left knee has pain 2 out of 10. It is constant. It is affecting his daily activity. Nice taking any pain medication. Like his blood pressure is 168/70, no fever, 98 degree Fahrenheit, respiration 16, heart rate is 70. He went to an urgent care a week ago where he got a tetanus shot and they put him on cephalexin 500 milligram BID. He also takes metoprolol and testosterone. Narrowing the differential diagnosis, for his right shin wound, it might be delayed wound healing since he's a pre-diabetic and he's a 51-year-old male. It could be localized cellulitis or an abscess formation. For the left knee pain, differential diagnosis is post-traumatic bursitis, knee fusion, or osteoarthritis. Hypertension may be related to his pain, anxiety, or medication non-compliance. Analyzing the differential diagnosis, for his right shin wound, he has persistent drainage and some redness that suggests delayed wound healing. The secretion is serous and it does not have any pus. Lack of systematic symptoms, for example, fevers or chills, makes this infection less likely. For the left knee pain, swelling is without redness. That suggests bursitis or post-traumatic effusion. Blood pressure elevation could be stress-related or pain-related. He is sticking to his medication regimen. My question for the preceptor is, should we keep him on Keflex or should we switch the antibiotics? The knee swelling, do we need an X-ray at this point? Or should we just do the RICE and NSAIDs and reevaluate him in a week? For blood pressure, are we going to manage it today or we will recheck? Plan is to keep him on Keflex. He does not have any allergies or any worsening. If the serous drainage continues or there is any change in the drainage, we might consider wound cultures. I would suggest wound care, change the dressing every day, put some Neosporin on it. Left knee pain, I would like to recommend some NSAIDs or Tylenol for symptom relief. I may consider X-ray if the pain still persists, the swelling persists. The RICE protocol, rest, ice, compression, elevation. For hypertension, I would suggest the patient to maintain a diary with blood pressure. When he comes back to the clinic, we can reassess that. Learning point is to change the antibiotic or when to call for a wound culture. I would also like to learn about when to get an X-ray versus ultrasound versus MRI. Management of blood pressure and different types of blood pressure maintaining agents. Thank you so much.